So today I'll be talking about the osteology of the hip as well as the femur and some of the ligaments as well. And this is in preparation for our first anatomy lab on Wednesday. So I'm going to start you off really basically, look at the ilium, ischium, and the pubis. Basically you have the ilium, and then anteriorly and superiorly you have the pubis, and then you have the ischium. All three of these bones converge at the acetabulum. So, as you can see, you have the ischium again, the ilium, and the pubis forming the fossa of the acetabulum, which I will come back to. And then finally, the last aspect of the hip is the sacrum and the coccyx, which, when articulating with the ilium, form the sacroiliac joint, which is a synovial joint. Now coming back anteriorly, looking at the um, ilium, basically superiorly we have the ASIS, or anterior superior iliac spine, and this is palpable on physical examination. And attaching to that and moving to the body of the pubis is the inguinal ligament. And then, so we have ASIS, inguinal ligament, and right below the ASIS we have the posterior superior iliac spine. And as you guys know, the inguinal ligament is one of the boundaries of the inguinal canal, which in males carries the spermatic cord, females carries the round ligament. Okay, now moving back to the acetabulum. Basically, we have the three bones defining it, and if you look inferiorly, we have the transverse acetabular ligament, which overlies what would be the acetabular notch, which I will now hide this ligament, and this would just be the notch inferiorly. And then this horseshoe shape that we have here is the articulate or lunate surface, which articulates with the head of the femur, which I'll be discussing later. And finally, we have the acetabular fossa, just this non-ligamentous area in here. Well, non-ligamentous in my diagram. And coming off that, we have the ligament of the head of the femur, which also brings along the ligament of the head of the femur, artery, and nerve. Okay. Moving on from that, moving now posteriorly. Basically, we have the greater and lesser sciatic foramens, starting with the greater sciatic foramen right here. Basically, we have the sciatic notch, the greater sciatic notch, defining its lateral borders, and then inferiorly we have the sacrospinous ligament. So here's the ischial spine, and then traveling across to the sacrum is the sacrospinous ligament. So greater sciatic foramen, greater sciatic notch. Moving inferiorly, we have the lesser sciatic foramen, which is defined as lateral border by the ischium, and the lesser sciatic notch, its inferior border by the sacrotuberous ligament, where we have the ischial tuberosity and a ligament moving up to the sacrum, defining its inferior border. So greater sciatic notch, greater sciatic foramen, lesser sciatic foramen. And through the greater sciatic foramen, we have piriformes and obturator internus come and connect to the greater trochanter of the femur, which I will discuss later, as well as the sciatic nerve, the largest nerve in the body, the largest peripheral nerve in the body. Okay, so moving back anteriorly, we're just going to take a closer look at the pubis. Basically, we have this superior ramus, which is kind of right along here. Actually, I'll just roughly, superior ramus extends a bit farther than that, and then the inferior ramus of the pubis, and then right here, kind of this square area, is the body of the pubis, through which you attach the two sides of the hip bone through the pubic symphysis, and it also attaches to the inguinal ligament. Now, inferiorly from the pubis, we have the ischium, and between the two of those, we define the obturator foramen, which is this nice big hole right here. Now, moving to the left side of my model, we can see that the obturator foramen is largely covered by the obturator membrane, and although I don't have it here, covering the obturator membrane is the obturator internus muscle. And if you guys remember, the obturator membrane is actually part of what forms the tendinous arch that the levator ani muscles is attached to from repo block. And now if we look here, we have this small obturator foramen through which the obturator canal is, and we have the obturator nerve, artery, and vein traveling through there. Now the last thing I wanted to discuss before shutting down here is just the femur. So once again, looking on the left side of my model, we have the head of the femur, which articulates with that lunate surface I was talking about, the neck of the femur, and then we have the greater trochanter, which is on the lateral side of the femur, and the lesser trochanter, which is on the medial side. Now the greater trochanter actually attaches to piriformes and the obturator internus, allowing for external rotation of the leg. Okay, and then we have, pretty basic, the shaft of the femur and the lineal aspera, which is on the posterior aspect of the femur, and you can see it's this kind of vertical groove, and it's a rougher surface allowing for muscle and ligament attachment. And then finally, moving inferiorly on the femur, we have the condyles, which I'll be talking about. This is the patella of the knee, and this is the tibia. I'm just going to remove the patella to expose the patella surface of the femur. And then lastly, the last thing I want to discuss was we have the lateral and medial epicondyles, which basically are the superior aspect of this kind of bump. So the medial epicondyle, the lateral epicondyle, and then the femoral condyles are the medial femoral condyle and the lateral femoral condyle. Alright, that's the last thing I want to discuss in this part 1. In part 2, I'll bring up a couple more structures and we can continue. Awesome.